Are abortion pills safe to use, and what are the potential risks or side effects of using them?
Is it safe? Yes. Overall, if you think it's safe, if it is used in the correct time with the correct prescription and the correct advice.
And many women also wonder about their future fertility after using these pills. So, how will taking abortion pills affect someone's fertility in the future? And can they later on become pregnant if they choose to?
So see, the problem with these pills are that usually there is an element of uncertainty whether the woman has completely evacuated the pregnancy or not. Two, because if a longer time passes between starting the process of induction of abortion and actually going through the complete abortion, there is a chance of infection. So that infection can potentially harm your reproductive system, harm the tubes, harm the fine reproductive functions which are performed by the uterus and the tubes. So yes, potentially there is a very small chance that there can be difficulty in becoming pregnant at a later stage, and therefore the importance of taking it under prescription and taking it properly.
Many young women in this country who unfortunately become pregnant when they are a teenager and have to go to shady places to take care of it. So for those women, who are scared and helpless, we should provide a wealth of information for them to be able to make an informed decision. So in your opinion, where can someone obtain abortion pills safely and legally in India?
Unfortunately, in India, the abortion pills are available over the counter. It was a policy decision taken by the government, keeping into mind the fact that we have a problem of a population.
Right.
So some amount of, they took a chance with the unsafe abortion part. Having said that, the correct way to go and take these pills will always be to a doctor, a gynecologist, and to take the prescription properly and legally, even though these pills are available over the counter. Basic advice for me to people and young girls will be that the world is opening up. Their family, I am sure, is opening up. I am sure their parents, mothers, brothers, sisters, friends are open to the idea that somebody can get pregnant unintentionally and unknowingly, and therefore it would be, the first step would be to open up to your family, to your mother, to your friend, somebody, and make sure that they help you go to the right doctor, and so that you don't have to go to shady places and don't have to take prescription from a medicine store or anything like that and fall in greater trouble, literally from the frying pan into the fire.
What is the success rate of abortion pills? Like, how can someone know if the abortion is incomplete or unsuccessful?
The abortion pills are prescribed, are approved for prescription only up to 7 weeks of pregnancy, which means about 2 or 3 weeks since missed period for somebody who gets a perfectly normal cycle, which means a 28-day cycle. So beyond that, the doctor also cannot prescribe. Now, the fact is that if you have taken it properly with a prescription, the doctor will prescribe it, the medication, and doctor will make you sign a consent form which informs you about all the side effects and potential problems of the pill, and will then definitely call you back after 2 weeks for a ultrasonography to make sure that it is completely evacuated the pregnancy and there is no element of incomplete abortion. This step is very important. Very often girls feel, or women feel, that they've taken the pill and they've got some kind of a bleeding and that's the end of the story. But unfortunately, majority cases it isn't. It takes longer time. Sometimes it needs to be prescribed. They need to be prescribed a second dose of the medication, and so it's very necessary that they go back for the second consult and for the ultrasound and make sure that everything is fine.
How soon after taking these pills can someone expect to resume their normal activities and daily life? And are there any precautions or restrictions that they should follow in the period after they take the pill?
So again, a very important point here I would like to tell my viewers is that very often they feel, I'll take the tablet and I'll get my menses. That's not correct. The tablet is going to induce a process of abortion. and the process of abortion itself happens in a certain manner,
Right.
which means there has to be heavy bleeding, there has to be pain, and there has to be a prolonged bleeding and pain. So that process has to happen because that is the process of abortion.
Mhm.
It's not like you're getting your menses.
Mhm.
So when you take the pill, you have to be prepared for a heavy bleeding, you have to be prepared for severe pain. If you're not prepared for these things, I see at a regular interval patients who are brought in stretchers with severe bleeding and severe pain, and so women need to be aware of that, and they need to know also that there are many complications that can happen with these pills, and they need to be aware of that. Yeah.
Now, our final question is intended to aid young adults who may be sexually active or may have multiple sexual partners in a certain amount of time. Now, these abortion pills may not be suitable for some individuals due to some pre-existing medical conditions or some other medications that they may be on. Plus, different contraceptive methods have different effectiveness rates across individuals. So, what are the best available contraceptive options to prevent future unplanned pregnancies? And can someone consult a specialist to get guidance on which is the best contraceptive for them and their bodies, which is personalized to their profile?
Okay, so I think there are two questions in your question that you asked. First is there any specific category of girls and women who are at higher risk for taking abortion pills? Yes, let's say those who are anemic. If they have little extra bleeding, it will become so bad that the body will decompensate and they will need blood transfusion and they will be in a bad shape. Somebody who has a heart condition, either they are born with congenital heart diseases, or they have acquired heart diseases, they have acquired or congenital kidney diseases, or else let's say they have some autoimmune diseases. So there are many pre-existing conditions which can make the side effects of these pills very bad. So yes, when you are taking a prescription, you must inform the doctor if you have any chronic illnesses. Let it even be as simple as a thyroid or a anemia. Second question, I think you are asking about contraceptive methods. Contraception, adolescent contraception, young adults needing contraception, etc. is a very important aspect, and people need to come out and talk about it and consult their doctors, because there are so many options for women, and especially young adults and women who are not in a stable relationship like a marriage. They need to understand that it's them that needs to look after their body. They cannot depend on the other partner to take care of contraception.
Absolutely.
So therefore, it's very much essential that they come and take advice from a doctor, because there are so many different varieties, and we cannot discuss that today. We can always be, even the oral contraceptive pills, which are the standard, which many young adults would take and should take also, they are also various types. Their ingredients are different. So based on let's say an obese adolescent or a thin adolescent, I will prescribe different medications.
Absolutely.
If let's say a girl who has acne and hypothyroid and things like that, I'll prescribe to her a different oral contraceptive pill.
Right.
So it's very necessary that the personalized part is done by the doctor. They can't decide on that. It's not okay to just, and there are so many different doses of the pills also available. So the bottom line is that contraception should be personalized. You have various choices of pills, injections, and each contraceptive will have its own side effects.
Right.
So that you need to understand and
Right.
personalize to your
Okay,
needs.
so thank you for sharing that information. I think it's absolutely important for people to start talking about it, so that these topics, which are traditionally considered as taboo and have prevented people from seeking the kind of help that they need because of societal pressures, should go down, and we should strive to make a society where young women feel comfortable visiting a doctor and having these conversations, so that they can design the best reproductive future for themselves and their families.
Very much.
Right. Okay.
Thank you.